a few words. Nobody is tired. So still a round of applause to Mr. Ruslan. You're most welcome. Thank you.
Hello, everyone. I believe this forum gives new opportunities to every one of us, every participant, because right now in Ukraine, we are indeed learning some unique experience, and I believe it should serve healthcare globally, contributing to our joint purpose, preserving people's lives and health. Ukraine has huge experience right now. We can train the whole world in rehabilitation, in demining, and other global challenges. So we encourage everyone to become our partners and to work in synergy with us. Despite the difficult situation, we are making steps towards the improvement of healthcare in Ukraine, and this summit exemplifies the efforts we are making. We are fighting for the life of health of every patient, despite their condition. Some of them need operations, some of them need prosthetics, some of them need mental health care. But all of these efforts are contributing to the health of the nation. I'm so grateful to the international partners, to those who have contributed to the development of Ukraine's healthcare, and I believe that every such meeting is supportive in the exchange of experience, in scaling up of the best practices in the care of those impacted by Russia's aggression of Ukraine. So we are going to sign an MOU today concerning the support of healthcare in Kyiv region. I'm grateful to our military, who are unique people, and thanks to whom we are able to have these 3 days in these calm conditions. I'm very grateful to another group of unique people, healthcare professionals who are fighting for our health. Glory to Ukraine, glory to the heroes. Thank you, Ruslan. And let us give the floor to the specialist of USAID, Mr. Robin Martz. Round of applause. Robin Martz. Let me kindly remind you that despite the fact that we have final moments of our event, everyone still deserves a warm round of applause. So, we have a microphone, but yeah, headset is another opportunity. Hello, I'm Robin Martz. I'm the new director of USAID office, and I'm very glad to be here with you.
In Kyiv last month, so I must continue in English. But I promise you I am studying Ukrainian. I want to thank JANZ Corporation and August Mission and Bruce specifically for asking me to come and speak at the closing of this amazing healthcare summit this week. Just a little bit more about me. I said I work for the United States Agency for International Development, or USAID, which is part of the U.S. Embassy here in Kyiv. Unlike many of you that were in the audience this week, I am not a clinician. I'm not a medical doctor or a nurse. My degrees are in public health and social work. And so in the United States, I worked in inpatient, both child and adolescent psychiatric units and adult psych, as well as I was part of a multidisciplinary physical medicine and rehabilitation team. And I mention that because of what we've been talking about this week and what we heard this morning. And my experiences working in both psych and mental health and rehabilitation led me to Ukraine. So when the US government and specifically USAID said, we need people to go to Ukraine and work, and I'm thinking, well, I've got kids at home, and this is a war zone, I raised my hand. And so here I am for 2 years to stand with Ukraine and until the war is won. So I just wanted to mention that. There are many of us, both Americans and Ukrainians, working very hard at the US Embassy here in Ukraine, in Kyiv, and working 6 and often 7 days a week, long hours. And I don't say that because I'm complaining. I say that because it's an honor. It's an honor for me. It's an honor for us to be here working with all of you. But what an amazing week. What a wonderful week of really thought-provoking sessions from really, I thought, a really inspiring opening session and panel on leadership, to all the technical and informative sessions, combat medicine, trauma, pain management, reconstructive surgery, mental health and rehabilitation that we heard this morning. All of these sessions really underscore the resilience of Ukraine's health system and that it continues to not only resist, but also recover at the same time from Russia's brutal, unprovoked war. So it goes without saying, but I'm going to say it anyway, the United States remains committed to helping Ukraine defend its freedom and protect its people, both physically and mentally, from the horrific crimes being committed by Russian forces against the people of Ukraine. Across the U.S. government, and I'll speak specifically from USAID because that's where I work, we have proudly supported many of the areas that have been discussed this week, like mental health, rehabilitation, and overarching health sector reforms. USAID has supported mental health in Ukraine since 2015, scaling up new models of mental health interventions, including non-medicalized counseling approaches that have been proven effective in war-affected communities. Through this work and other projects, we are working hard to support a very responsive mental health care system in Ukraine, and that one that is accessible to all Ukrainians. As we heard earlier, it's not just about the warriors and the veterans coming off the front lines, but it's really about all Ukrainians. USAID directly supports the First Lady of Ukraine's mental health initiative to ensure that all Ukrainians can receive the mental health care that they need in the communities where they live. USAID and its partners have trained over 1,200 primary healthcare providers in implementing the WHO-designated Mental Health Gap Action Program, or MHGAP, that is now being applied in 139 healthcare facilities across 8 oblasts. We work closely with the Ministry of Health to strengthen the Lizova Poliana Veterans Hospital in Kyiv, which will serve as a national training hub for strengthening the capacity of mental health providers working with veterans and their families. USAID also works to strengthen the rehabilitation sector here in Ukraine. Our work focuses on strengthening the entire rehabilitation service delivery system, from policy to regulatory framework to capacity building of Ukraine's physical therapists and increasing access to assistive technologies. Work that will become even more and more important as Ukraine treats those wounded by Russia's unjust war. But USAID's work to strengthen the healthcare system also focuses on a bigger picture. And some of those examples you can see in some of our investments in e-health and telemedicine. So these initiatives, of course, are led by the Ministry of Health, but we are investing in many of these, including a number of anti-corruption efforts across the health system. So the national e-health system includes more than 30 private medical information systems certified by the government of Ukraine, providing paid services to thousands of Ukrainian primary healthcare clinics. Hospitals, pharmacies, these are all contracted by the National Health Services of Ukraine, the NHSU, under the state program of medical guarantees, which is that package of services that Ukrainians receive. USAID's investments in health system strengthening have helped to ensure that the private sector also has a space and a voice in the development of national digital health policies. USAID has helped medical information system providers assess and improve their cybersecurity and data protection, which, as you know, is critically important in this context with Russia's increasing cyber attacks on Ukrainian critical infrastructure. Since the beginning of this full-scale war in Ukraine, USAID has catalyzed public-private partnerships between the government of Ukraine and international private companies, resulting in the donation of various telemedicine solutions. USAID-funded international and local experts have evaluated, adjusted, and helped pilot these telemedicine solutions in local hospitals and remote rural health clinics. USAID has helped develop such public-private partnerships between the Ministry of Health and telemedicine providers from the United States, from Poland, from Spain, and elsewhere. And they are now helping Ukrainian doctors provide life-saving care to patients who live near the front line or in very remote areas. One of our partners shared this with me, which is the story of Svetlana, who was living in the frontline area of the Kyiv region, and who was 8 months pregnant and could not come to the hospital for fear of, injury due to the constant Russian shelling. So with a portable diagnostic device that was able to monitor the fetal heartbeat, her doctor, who was based at the Kyiv Regional Hospital, Igor, was able to receive this monitoring that Svetlana was able to do at home. And when the device recorded some concerning indicators to the doctor, he took immediate action and ordered her evacuation to the hospital, where Svetlana safely gave birth to a healthy baby boy. So USAID understands how important these partnerships are, and I want to thank Bruce and team and everyone here this week, because while the specific technical sessions have been wonderful, the connections and the relationship building is obviously an important and a key part of this week. So we understand at USAID how important these partnerships are, and we are excited that providers can now use the telemedicine consultations to connect with counterparts from the Mayo Clinic in the United States, from Charity Clinic and BG Clinic in Germany, and the Saskatchewan Polytech University in Canada. So since February 2022, the donation of telemedicine solutions and services have trained nearly 1,300 healthcare providers in Ukraine and provided services to more than 7,000 people at 324 healthcare facilities. So these are just a few examples that I wanted to share with you of how USAID's health investments are making a difference in the life of Ukrainians and helping to exact some systematic change for the advancement of Ukraine and its health system. The physical and mental health of Ukraine citizens is paramount in ensuring its future recovery and economic recovery. And to truly meet Ukraine's needs, we must be steadfast in our commitment over the long term. And so I will say it again, explicitly and loudly for all to hear: the United States and USAID stands shoulder to shoulder with Ukraine. We are committed to continuing to invest in Ukraine's physical and mental health needs now and into the future. Дякую Дякую за увагу і слава Україні!
Героям слава! Дякуємо, пані Робін. У вас
Thank you, Ms. Robin. Your Ukrainian skills are wonderful. And right now, let us give the floor to the founder of August Mission, Mr. Bruce Robbins. Round of applause.
All right, as we head into our closing ceremony, I'll be brief and try to wrap this thing up. I want to thank everybody again. I know I thanked everyone for being here at the beginning, but I think it means more now for all the hard work in organizing this thing. I want to thank the hotel for being gracious hosts and giving us this beautiful facility in order to have this event. I have also want to thank my team that put a lot of hard work into organizing this and bringing it all together. I mean, we had an amazing panel of speakers. The participants that spoke and shared their knowledge with us and their experience, I want to thank them for being a part of our conference. I want to thank Rick and his team for helping us put this together and supporting us. And you and I coming up with this crazy idea back in May. Here we are 6 months later pulling it off. So I think it went really well. I want to thank Robin for your support, and Nathan, please pass along my thanks to him as well for the support of the U.S. Embassy, both USAID and the commercial office. They've been great partners and great supporters of what we're doing. I want to thank some of our sponsors in the back, AMI Health. Scott, raise your hand. Thank you so much for helping us do this. It's a great partnership we made with you. We couldn't have done it without you and your team, so thank you so much. I mentioned in my opening remarks that I personally had 3 objectives coming into and now out of this summit. The first one was collaboration. And as Robin just mentioned, I think we did that. One of the bits of feedback I'm getting from the Ukrainian side is that us putting together a venue and an event where they could come together and collaborate with their colleagues has been of huge value. So for me, that's a huge win. I feel good about that. Number 2 is education. I think we achieved that as well. I'm looking at all the products that were introduced. I'm looking at the new techniques that were introduced. I'm looking at everybody taking pictures of it with their cell phone and then making those connections and talking to their colleagues over coffee. I think we've succeeded in creating an educational environment where we can all share some of the lessons we've learned and the things we've learned and new technologies and innovation. And the third is awareness. So we have to continue to beat that drum. I'm hoping that we come out of here with a lot of great media and we just shout it from the mountaintops about what's happening here, what the needs are, and how we can continue to help. I love that message from Robin and USAID that we continue to stand shoulder to shoulder with Ukraine. I think we have to do that. I think the world has to do that, and we're not going to give up. So even as tragic as this war is, amidst all this tragedy, and you see it in the pictures that we've seen over the last few days are just heartbreaking. It's horrible. But amidst the tragedy, there is also opportunity. There's opportunity for us to do things like this, for us to come together, for us to learn from each other. And if we don't take advantage of the opportunity that is coming out of this tragedy, then we're left with nothing but the tragedy. So what's happening right now? I mean, we're innovating in different ways. I mean, obviously, Ukraine is innovating in techniques of warfare, which is unfortunate but necessary for them to win the war. But we're also innovating in the fields of medicine, in the fields of technology. And we're sharing those lessons and we're learning from each other. So I think we have to take advantage of these opportunities to learn and do things in a very positive way as well. Amidst all this tragedy, we have to do that. We have to stay positive and learn from each other. I mentioned briefly at the beginning that August Mission is a small organization. We don't have a lot of power or money or anything. So what can we do? Well, we can bring people together. And that's what we succeeded in doing here today. We brought people together And that's how we can make a difference, is by making these connections, by learning from each other, by supporting each other, by finding out what each other's strengths are, and then leveraging those strengths to make a difference as we come together to try to win this war and help Ukraine rebuild. So in coming together and seeing how well this went and how successful and how valuable it was to all those who participated, my initial plan was to do this every year. I was in the lobby yesterday speaking with Irina from Unbroken, and we were having this conversation, and I thought, I mentioned to her, I said, well, maybe I should do it every 6 months, because this seems just like such a critical time. How can we let a year pass and not continue to have these conversations and capture these lessons and create these collaborative opportunities? And she said, yeah, you should do this every 6 months. So expect us to be back here in the spring, hosting something similar to this, and trying to make it a fruitful and beneficial event for everybody, and to create these connections and to continue to collaborate, because together we can make a difference. I thank you all for being here. Thank you for your time and attention, and I really appreciate you. Slava Ukraine.
Героям слава. Дякуємо.
Thank you. Let us give the floor to the founder and CEO of JANZ Corporation, Rick Finsterbush. Round of applause.
Thank you. And I really do appreciate all your attendance today. I think one of the things we got to see while we were here, visiting the soldiers in the military, talking to them, the horrific things that they've been going through. But I also wanted to address somebody very special today with us, Lena. Come on up. Lena, when we started, Bruce, told me about Lena, and she could work with us, and help us in Ukraine. She's Ukrainian. And I really have to tell you that we could not have done this without her. For me, it was a small, dream that we started with, because we knew we could do something that wasn't being done. But the number of times we spent on the phone, on Zoom calls, and reaching out to doctors, I really honestly believe that this could not have happened without Lena. So Lena, thank you very much, and we wanted to present you with some flowers and
Неочікувано. Дякую. Мені дуже приємно бути.
It's quite unexpected, and it's a pleasure for me to be a part of this project. I believe it's just the first step to the great future ahead of us. And together with August Mission and JANZ Corporation, we are going to accomplish a lot. I believe in healthcare. I believe in the future of it. And I believe that our healthcare professionals are worthy to be invited to such events, and their experience is worthy of being shared around the world, because the experience they have is something unmatched in the world. Despite the limitations of the equipment they sometimes have, they are saving our defenders, who are so important to us. I'm grateful to all of you, and encourage you to sign the MOU today, and I will be pleased to see the results of our continued cooperation. This was Lena Balay. A round of applause for her. Sign an MOU. The document initiated our cooperation. So I'm pleased to invite here Ruslan Kravchenko, Bruce Roberts from August Mission, and also CEO of JANZ Corporation, Mr. Rick Finsterbush. Round of applause, please.
Ну, власне, відбулося. Не хотілося перебувати.
Yep, this has happened in this sullen silence, and our photographers documented this. MOU has been signed, and Ruslan, Bruce, Rick, let us make a photo together and share a couple more words, and that will be it. So you can make a photo with the MOU or without it, as you choose. This photo will launch the long-time cooperation and hopefully very fruitful one. So lots of photos are being taken right now. Ruslan, let us give the floor to you for a couple more words. And yeah. Thank you so much, our partners, for this unique opportunity that we got here. It's not just signing an MOU, but it's creating an opportunity. And hopefully a year from now, we will be discussing the results we've been able to accomplish. And I'm sure we will have huge results. Thank you. So, dear friends, Ruslan has indeed envisioned the future accomplishments that we will all be glad to hear about. And we all know that the summit was supported by the important partners to which we are grateful. And now let me announce that this event is officially over. A round of applause for every one of us. A round of applause to those for whom we are working. Our glorious defenders, the armed forces of Ukraine. For the glory of the Ukrainian flag, glory to Ukraine. Thank you.